Welcome to Thursday's edition of COVID-19. The daily tally remains little changed from yesterday. Authorities have recorded close to 700 cases today as well and are emphasizing the need for strict adherence to social distancing guidelines. I have our Kwon Soa standing by with more on the local and international fronts. Now, Soa, let's begin with the latest here in Korea.
Sure, Sunny. For another day, we are seeing an alarming figure. As you just said, close to 700 infections were reported this Thursday, 682 to be exact, and also close to 500 in the metropolitan region, which is the current hotspot here in the nation when it comes to the COVID-19 virus. And with that, Korea has surpassed 40,000 total accumulated cases, and it just took 19 days to get from 30,000 to 40,000. And in detail, that's 40,098 infections we're seeing now. And also the death toll is rising day by day. 8 new fatalities were reported in the past day. And also the number of people in serious to critical condition is rising day by day as well, with 23 more than yesterday at 172. And that is the result of daily infections between 500 and close to 700. And for 33 straight days, we have been seeing triple digits here in Korea.
I see. So in a bid to slow the spread, I understand authorities are setting up more testing sites here in the Greater Seoul area.
Right, Sunny. As part of efforts by health authorities to detect the COVID-19 virus much faster, 150 provisional testing centers will operate beginning Monday, with aggressive testings to be conducted for the following 3 weeks. And this amid a rising number of patients showing no symptoms of the virus, especially among younger people. That's also why many of the makeshift screening centers are to be installed near universities as well as around Seoul Station. And to encourage more people get tested voluntarily, the government decided to allow anonymous testing, as had been done earlier in May amid cluster infections linked to clubs in Seoul's Itaewon district. And they are free of charge regardless of symptoms. And speaking of Itaewon, there are also new cases related to that district in the capital Seoul this Thursday, with 251 new infections here, 215 in Gyeonggi-do province and 37 in Incheon. We also have double digits in many other parts. And here, what's standing out is Jeju-do Island also had a double-digit figure of daily cases, a record high there. And with that, Jeju-do Island has also surpassed 100 cases. So all places now have triple-digit figures. We also see a rise in imported cases this Thursday, with 19 of those from the U.S. Speaking of the U.S., let's take a look at the figures here. 15.8 million cases here, and followed by 9.7 million in India and 6.7 million in Brazil. Let's take a closer look at the daily increases. Here, the U.S. set more than 228,000 infections, also resurgences observed in Brazil. And Germany recently had a daily high when it comes to fatalities, also seeing almost 24,000 new infections. And Turkey steadily seeing over 30,000 cases on a daily basis. And with that, the total number of infections around the world is alarmingly close to 70 million, now currently at 69.2 million. And those are the figures I have for now, but I'll be back after the government briefing. Sunny?
All right, so thank you for now. Let's now take a broader look at the local situation here in Korea, where escalating cases are looking to exhaust our medical supplies. I have our Kim Ji-yeon here in the studio with me. Welcome, Ji-yeon.
Hello.
Ji-yeon, do start us off with an overview of the local situation then.
Sure. South Korea reported close to 700 new infections for the third straight day, with the tally yesterday being the second highest on record. This is mainly due to infections in the Seoul metropolitan area, which reported more than 500 COVID-19 infections on Wednesday, the highest number of daily infections in the capital area since the start of the outbreak. And these include cases stemming from cluster infections at a poker bar in Itaewon, a marketplace in Seoul's Junggu district, and singing classes in Jongno district and nursing homes across the region.
We believe widespread infections that are either asymptomatic or latent are primarily to blame for the muted effects of our social distancing measures.
Level 2.5 social distancing measures for the capital area and level 2 for other regions have been in place since Tuesday. But with numbers still increasing, the government could consider raising the measures to level 3, the highest level.
I see. Jian, there are also rising concerns of potential shortages in supplies.
Yes, health authorities are concerned that hospital beds for COVID-19 patients could run out amid the latest outbreak. And as of Tuesday, the Seoul Metropolitan Government says out of the 62 hospital beds it has set aside in specialized COVID-19 treatment centers for the critically ill, only 3 are remaining. In response, the government will be setting up some 150 temporary facilities in the greater Seoul area to ramp up testing for the next 3 weeks. And modular sick beds inside containers have been set up at the Seoul Medical Center, while more residential treatment centers for patients with mild symptoms and specialized COVID-19 treatment centers are being set up.
Well, that is reassuring to know. What news do we have on vaccine procurement?
Well, the South Korean government had announced earlier to secure vaccines for 44 million people, or around 85% of the country's population. In an emergency meeting held on Wednesday, President Moon Jae-in vowed that the government will promptly secure enough vaccines, even if it incurs additional expenses.
재정적인 부담이 추가되더라도 국민의 안전과 생명을 최우선으로 고려해 주기 바랍니다. 그 효과와 부작용 등을 충분히 모니터링하여 우리나라에 백신이 들어오는 대로 신속히 접종이 시작될 수 있도록 접종 계획을 앞당겨 준비해 주시기 바랍니다.
Despite possible delays in the UK, which has started its vaccinations, Korean health authorities say procuring AstraZeneca's COVID-19 vaccines for local distribution will be carried out without a hitch. And authorities say locally manufactured AstraZeneca vaccines, which will be produced by SK Bioscience, will only be distributed to Korea and not shipped elsewhere. And Seoul's health ministry has announced deals with 4 drug makers, namely AstraZeneca, Pfizer, Johnson & Johnson, and Moderna, which will provide enough doses to inoculate 34 million people. Vaccines for 10 million people will also be secured through the Global Vaccine Initiative, COVAX.
Right, Jian, one final question about AstraZeneca before you go. I understand it published its full set of vaccine trial results.
Yes, up until now, like Pfizer and Moderna, their clinical trials were not they were released through press releases and were not reviewed by peer-reviewed academic journals. But AstraZeneca became the first vaccine developer to publish their full test data in the British scientific journal, The Lancet, this week. It seems to have addressed many questions concerning the reliability of the vaccine sparked earlier this year, as some clinical trial subjects reportedly got only a partial dose. And the latest data show that AstraZeneca vaccines are safe and about 70% effective, which is lower than the initially claimed 90% efficacy. But questions still remain on how well it can protect those over 55 years old, which is key in fighting the coronavirus, since the majority of severe illnesses and deaths occur among these older patients. Researchers are also still trying to determine which dose regimen can produce the greatest protection.
All right, Jian, as always, thank you for that coverage.
Thank you.
Right, it's a little after 2 in the afternoon here in Korea, and we are poised to join the regular briefing on COVID-19 for this Thursday. Now, while we wait for that to start, perhaps we can take a quick look at the level 2.5 social distancing measures currently in place, as our Cheon said, here in the Greater Seoul area. First, do remember that mask wearing is mandatory at all places outside of one's residence, regardless of the social distancing level amid the pandemic. Failure to abide by this rule can result in fines of up to 100,000 won. Right, gatherings of more than 50 people are banned. Such gatherings include weddings and funerals. Also, 1/3 of all public servants and workers at public entities have to work from home. Sporting events need to take place in the absence of spectators. Meanwhile, at places of worship, in-person congregation is limited to 20 people, and online religious sermons are strongly advised, while small gatherings for choir practice, Bible study, and meal sharing are banned. In the academic arena, all schools face a 1/3 attendance limit with strong calls for online lectures. High-risk facilities, including clubs, bars and singing rooms, have suspended their operations, while high-risk activities such as door-to-door sales are not permitted. Now, cycling and horse racing tracks are closed, as are cram schools and indoor sports facilities. Public facilities such as libraries and museums need to abide by an admissions cap of 30%. Right, the briefing is about to start. We'll come back to you afterwards with a summary.
First of all, we have Mr. Lee Sang-won with the briefing. Let us now begin our regular briefing on the COVID-19 situation here in South Korea. As of December 10th, Thursday, we have a total of 646 new local infections and 36 new imported cases. The total case load now stands at 40,098. Currently, we have 8,897 people remaining in quarantine, and there are 172 patients with severe or critical conditions. And we also had 8 additional fatalities, and the accumulated death toll now stands at 564. I extend my deepest condolences to the deceased and the members of the bereaved families. Let us go over the major updates on the domestic cases by region, starting in Gyeonggi-do province in relation to a nursing home in Suwon City. We also have the first index case being identified earlier this month, and we have 20 additional cases. And in total, we have 21 cases being confirmed to date, and the index case is also linked to the family of the member who went to the restaurant and the singing class of Jongno-gu district in Seoul. And in relation to Anyang City, we have the religious facility, and we also have identified that 16 additional patients have been confirmed, and in total, we have a total of 17 patients being confirmed to date. And in Gyeonggi-do province, Hwasong City, in relation to a cram school, we have the first index case being identified earlier this month, and we have 11 new cases. And in total, we have a total of 12 people being confirmed to date. And in relation to a social gathering and kimchi making meeting in Daejeon, we also have additional cases being confirmed, additional of 12 cases being confirmed, and a total 13 have been confirmed to date. And in Ulsan Namgu district, in relation to a middle school, we have the first index case being identified on the 8th of December, and we have identified 19 additional patients. In total, there are 20 patients to date. And in Busan, in relation to a nursing hospital in Sasangu district, we also have found that 19 additional cases have been confirmed, and in total, we have 25 cases to date. As for other cluster infections, please make your inquiry to the spokesperson's office after the briefing for detailed information. Currently, we are seeing a major outbreak here in South Korea, and among these three major outbreaks that we are witnessing here in the country, it is the most prolonged one that we are seeing right now. And until we completely fight over the COVID-19, we will have to go over many hurdles and many challenges, and we believe that this is actually the greatest challenge that we will face. It is a very critical moment right now, and thanks to the public's participation in the social distancing measures, we are having a reduction of the reproduction rate of the COVID-19 virus, and it has dropped significantly. However, there are still increase of the confirmed cases, and they are resulting from many places, including military units, as well as many other multi-use venues, and those are closely related to our day-to-day lives, including restaurants and so forth. And in the metropolitan area in particular, we are seeing multiple cases of our new domestic cases, and we will also redouble our efforts to intensify more testings. And regardless of their symptoms, we will set up more temporary screening centers in the metropolitan area, and they will start to run from one day from next week. And the samples collection and the testings will also be conducted anonymously, and if wanted, we will also carry out the saliva testings as well as the rapid antigen testings as well. And we would like to highlight the following. We would like to highlight the importance of monitoring your health conditions for those in the elderly, and especially those over the age of 60. We have seen that these COVID-19 patients develop severe or critical conditions. And we have also want to highlight the importance of participating in the social distancing measures for the senior citizens. And it is a very unfortunate, however, it is very important that you take care of yourselves amid the COVID-19 spread. And as we said, we are facing a very difficult situation right now, and we need to exert our full efforts to comply with social distancing measures and contain the virus going forward by minimizing our physical contact. And we have already learned from our two previous challenges, and we believe that this specific challenge would be the biggest hurdle that we will face. And due to the COVID-19, the globe, the entire world is living actually a very new era, and it is difficult times for all. However, we ask you to comply with these new norms. And for the sake of the safety of all, please get tested as soon as possible. Thank you very much.
질문에 답변 드리는 시간 갖겠습니다. 사전 질문.
Right, that was Lee Sang-won at the Central Disease Control Headquarters, SOA, with Thursday's afternoon briefing. What did he have to say?
Let's take a look at the updates on the major cluster infections here in the nation first. As most of the cases are concentrated in the metropolitan region, he named some in Gyeonggi-do province. A nursing hospital in Gyeonggi-do province has a total of 21 infections, and that seems to be originating from an infection in the capital Seoul that was linked to a restaurant. And also new infections at a cram school in Gyeonggi-do province. And when we go over to Daejeon, there's been one cluster related to a kimchi making gathering, and a middle school down in Ulsan has a total of 20 infections, and a nursing hospital outbreak in Busan with a total of 25 cases. And he mentioned that as many people have been abiding by social distancing measures, the reproduction rate of COVID-19 has been going down, but it's still above 1, which means one person can infect more than one person. With that, he also asked for the elderly people to be especially cautious at this time, because people aged 60 or above who get infected by the virus, out of them around 10% get to become patients in serious or critical condition. He also mentioned the provisional testing centers that will start to operate next week for 3 weeks.
Right, and you can get tested without giving your personal details, you
Exactly,
said.
and it's going to be free of charge as well.
I see. All right, so thank you for that. I'll see you again tomorrow.
See you tomorrow.
Right, today, December 10th, is Human Rights Day. And in light of this occasion, let's take a look at the issue of human rights under the framework of restrictions to fight the pandemic, as observers claim the health crisis is also fueling violations of civil rights. Do take a look.
With level 2.5 social distancing measures now in effect for the capital region starting on December 8th, stronger mask-wearing rules are also being enforced.
실내 전체와 2m 이상 거리 유지가 되지 않는 실외에서의 마스크 착용이 의무화됩니다.
Korean citizens have been diligent for the most part in wearing their masks, even before the mandates were rolled out. In a recent survey, an overwhelming 7 out of 10 Koreans agreed that people who fail to wear face masks should be fined. However, anti-mask sentiments have erupted in the US and countries in Europe, with opponents arguing that wearing a mask should be a matter of personal choice, and that any mandates in this regard is a violation of their civil liberties.
Because the way we manage pandemics and the way pandemics have been managed across the world is communities have to agree to give up small freedoms. And there are freedoms like having to wear a mask, socially distancing, going into lockdown, things like that. We all have to give up those sorts of freedoms. I don't see that as a violation of civil rights. I see that as good common sense as a means of getting this pandemic under control.
Much praise has been lavished on Korea's COVID-19 containment measures, especially in carrying out the 3 T's: testing, treatment, and tracing. However, privacy issues have emerged over Korea's contact tracing efforts and the disclosure of highly sensitive personal information in the interest of protecting public health.
민감한 정보, 성별이나 아니면 성적 정체성을 드러낼 수 있는 자료라든지 아니면 이제 종교라든지 이런 것들을 드러낼 수 있는 그런 민감 정보들을 공개하지 못하도록 하는 것이 필요하다고 생각을 합니다.
To address these concerns, the government has reduced the scope of the personal information subject to disclosure, while contact tracing data now stays on public records for a shorter period of time.
확진자의 사생활 보호 등의 다각적인 측면을 고려해서 감염병 예방에 필요한 정보의 하나여 공개하는 것이 필요합니다.
Another issue of great concern is that of stigma and discrimination targeting COVID-19 survivors. There have been instances in countries abroad of COVID-19 patients who were either laid off from work or refused to be granted paid leave. One local business here in Korea was also embroiled in controversy for putting out a notice saying that any workers who contract COVID-19 would face negative consequences, while workers at another company were asked to quit their jobs altogether.
인권위원회법에 따르게 되면 차별을 얘기할 때 병력에 따라서 차별할 수 없다라고 하는 내용이 있거든요. 또 이러한 내용들은 국가뿐만 아니라 사기업에 있어서도 병력을 이유로 또는 그 사람의 건강 상태나 이런 것들을 이유로 해서 합리적인 이유 없이 차별을 해서는 안 된다라고 하는 이제 그런 규정이 있습니다.
So how do we walk the fine line between protecting public health and people's rights to privacy at the same time?
방역 역시 인권을 보호하기 위한 것이고 거기 인권에는 단순히 이제 건강권뿐만 아니라 다른 인권을 보호할 것도 이제 들어갑니다. 따라서 이제 방역과 인권을 대립 구도상에 놓지 않고 어떻게 하면은 방역 상황에서도 기본적인 인권을 보장하면서 국민의 생명권과 건강권을 보호할까 이런 고민들이 국가에서 이루어져야 된다라고 저는 생각을 합니다.
More public discourse will be needed to ensure that our efforts to fight COVID-19 do not come into odds with nor undermine our fundamental civil rights.
Human rights cannot be an afterthought in times of crisis. And in all we do, let's never forget, the threat is the virus, not people.
코로나19와의 전쟁은 우리 모두가 힘을 모아야만 이길 수 있습니다. 서로 간의 반목이나 낙인 찍기는 위기를 극복하는 데 결코 도움이 되지 않습니다.
Today, we explore the issue of human rights amid the pandemic as efforts to fight the health crisis are seen to be hurting civil rights. I have Professor Cho Hee-kyung from Hongik University. Pleasure to have you back, Professor Cho.
Hello, good to be back.
And I also have an attorney, Park Ye-an, from Konggam Human Rights Law Foundation. Welcome to the program.
Thank you for inviting me.
Professor Cho, to mark Human Rights Day, the head of the United Nations has reiterated the need for people and their rights to be front and center of the response and recovery from the pandemic. What do you believe is the reason for this emphasis on civil rights amid the pandemic?
So we just saw Mr. Antonio Guterres actually speaking in that short clip. He said it's the virus, not people. And the longer this pandemic goes on, it seems that there is a tendency among at least some parts of the society to wanting to find somebody or certain group to blame. And that seems to be coming to the fore. But we have to remember that this is a global pandemic and we need a global response. We can't simply point finger at a particular group and hold them liable and blame them. That's not really going to solve anything. I think the second aspect of it is the fact that this pandemic has really highlighted the extreme polarization in our society, not just domestically but globally. And it's really the poor, the weak, the old, the helpless, the minority who've been affected disproportionately through this virus. And he's also, I think, pointing that out and reminding the better off nations not to forget those left behind. And now we are looking at vaccination, and so there are concerns over, vaccination hoarding, for example. And so just remembering that we should really keep in mind solidarity on a global scale.
Right. As a lawyer yourself, what are your thoughts on Mr. Antonio Guterres' emphasis on people and their rights amid this pandemic?
Well, at a time when everyone is in panic mode, in the face of the challenges caused by COVID-19, raising the issue of human rights violation can be easily dismissed amid the urgency to prevent the spread of the virus. However, taking the drastic preventive measures that may result in sacrificing the rights of the vulnerable, like Professor Cho said, justified under the collective fear of pandemic, it is in itself a great threat to the human rights in its entirety. And no matter how dire the situation may be, if we as a society fails to establish clear procedures and strict requirements based on the well-established human rights principles that we've worked so hard to really strengthen, especially more so in the case of quarantine, which is peculiar to COVID-19 issue, it would prove to be nearly impossible for us to prevent further human rights violation if and when we find ourselves under similar circumstances again. And as such, respecting and adhering to the human rights principles in times of unprecedented global challenges like COVID-19 pandemic would be the greatest test for the humankind and the global society as a whole as we move towards the better future.
Right. Professor, if we were to place Korea's prevention measures within the context of personal rights, what problems would we see?
So there is one criticism that we have faced from the very beginning in our COVID response, which has actually proven to be very effective. So the three pillars were test, trace, and treat, right? And it's the second pillar, tracing, that has been problematic from the beginning. And other countries who've looked at how effective we were in dealing with the pandemic at the beginning and really sort of limiting the numbers and keeping it down, were always going, yes, Korea is doing well, but there was always this but, saying that, well, they're only doing well because they are not respecting people's privacy. They are disclosing personal information. They are tracing people to the extent that it's no need to do so. And in fact, all of those criticisms are justified. And the defense that we've had so far is that we needed to do that to effectively combat this serious, life-threatening virus that is really kind of threatening the existence of humankind, right? But having said that, what Ms. Park has mentioned is precisely right. It's not an either-or situation where you can either protect public health but roughshod all over human rights. The key here is, I think, proportionality. And it is possible to trace the movement of person without having to disclose that person's age, gender, name, address, etc. But we've had this regime in place since the MERS crisis back in 2015, right? And it was basically a knee-jerk reaction to what was a very ineffective response by the then government and the authorities that led to unnecessary spread of the infection. And they were so concerned with not disclosing personal information and also the adverse impact it might have on various institutions that the infected people had visited, that they decided to basically not disclose anything. And that really made the situation a lot worse. And so in response to that, a real knee-jerk reaction, they basically decided, okay, for public health reasons, we can disclose anything. And the clip that you showed previously mentioned how the law is now changed. It's come into effect recently that you can only disclose personal information to the extent that it's absolutely necessary. You can disclose the person's movement, where they had visited, etc. But you don't need to know that person's age, what gender that person is to actually know where they went to, right? So it's again coming back to proportionality. What would you do if you were that person? You don't really want your personal information to be disclosed.
No, that's true. And staying with the idea of tracing, how was Korea able to conduct such an effective, as Professor Cho mentioned, and extensive virus tracking system?
Right, so following up with what Professor Cho just explained, one of the factors that enabled the Korean government to respond to the COVID-19 so swiftly was that it has already established a legal basis for compulsory countermeasures through the amendment of the Infectious Disease Control and Prevention Act. After a massive outbreak of infectious disease caused by the spread of the Middle East Respiratory Syndrome virus, also known as MERS, back in May of 2015. So at that time, in a very short amount of time, the spread of virus caused nearly 20,000 people to be self-quarantined and nearly 1,000 people to be quarantined at hospital. And that was for being exposed or possibly exposed to the virus, pretty much similar to what we are going through under COVID-19. And just as Professor Cho mentioned, afterwards, after this fiasco has passed, strong criticism followed, arguing that the government had missed this critical window of opportunity to prevent the spread of MERS virus by refusing to disclose the list of hospitals where the infection had first broke out. And since then, the government has introduced this Article 34-2 to the Act, which provides for the Minister of Health and Welfare the authority to promptly disclose information to the public that are deemed necessary to prevent the spread of the infectious disease, such as medical history and details on credit card usage of the confirmed patients. Now, it's arguable which and who decides what's deemed necessary to prevent the disease. But this amendment has so far provided the legal basis for the government in adopting a lot of measures in relation to disclosure of information. And so far, the Act has been amended a couple more times amidst tackling the COVID-19 pandemic.
Right, indeed. There have been legislative revisions since 2015. And as part of such efforts, like you mentioned, I think on the 30th of this month, the disclosure of COVID-19 patients' information such as name, gender, age will be prohibited. Do you believe such efforts will serve to better protect personal rights?
Certainly. I mean, it's much better than the free-for-all kind of regime that we had under the law. Just as a comparison, I look at Germany's case. Germany also developed a similar tracing app, but it was for people to voluntarily download onto their mobile phone, and it would basically sort of alert you if you are close to a place where an infection had occurred, or if you are in the vicinity of a person who had been diagnosed. But because it was purely voluntary, only about 18 million people out of a total population of 80 million had downloaded the app. And so the authorities are saying, well, the app is working really well, but for it to be actually effective, we need more people to download it. So we do see, the advantages of essentially mandating a system and forcibly requiring information like this in times of emergency. But at the same time, we need to be mindful as to how wide that scope is. We don't really want to live in a world where our rights are taken away simply in the name of protecting public health. The images from Wuhan, China, back in January and February of this year are still fresh in my mind. People were being shut. Actually, their gates were being soldered by police, and people were locked inside, not being able to venture outside at all, even for food shopping. How were they supposed to survive? And they now claim the success was due to these extreme iron-fisted measures that the Chinese government had taken. And that's all very well and good, but is that the kind of society I want to live in? I'm not really sure that is necessarily the case. I mean, certainly you can go to the other extreme, like in the United States, where people seem to prefer their freedom over their health. But there has to be a certain middle ground, and I think we're still struggling. And obviously, it's not an easy problem to solve because what is at stake are essentially the kernel of these very basic rights that we all want to have as human beings: right to health, as well as right to privacy, right to free speech, as well as right to life. And so the question is, how do you achieve the balance?
Right, and I extend that question to you. As a lawyer, how do you believe can we seek a middle ground between those who demand personal rights and others who claim that public health or welfare overrides that?
Right. That certainly is a very tricky issue to tackle. And when we're swept in fear, one is inclined to find a way to alleviate one's anxiety at any cost. It's more of a instinctual, tendency, and such strong need to take immediate action to address the cause of fear takes precedence over actually evaluating the necessity and proportionality of the measures that are to be taken. Yet, imposing any restriction on human rights should be carefully and thoroughly examined for its validity and appropriateness, especially in times of crisis. It cannot be denied altogether that the identification of contacts through tracing the past movements of the confirmed patient, which Korean government has done, followed by taking proactive measures such as prompt diagnosis and quarantine, contributed to controlling the spread of COVID-19 to some extent. However, it should also be noted that once medical records, credit card transaction records, and travel log via GPS information, they are all very sensitive personal information that may reveal quite a lot about you than you'd expect or you'd desire. And as such, even when the collection of such data is absolutely necessary, let's just presume that it's totally necessary, it needs to be done to the minimum extent necessary, and there must exist an appropriate supervisory mechanism in place to prevent the abuse of authority or the misuse of collected data, which are actually happening. We are seeing a news clip saying that the data has been sold for, for the economic gain, not to be used for the COVID-19 related measures. So having this supervisory mechanism, I think we can aim to find a balance between these two very important but not necessarily conflicting issues.
Right. Now, as you mentioned, Professor Cho, a host of restrictions have been put into place to curb the spread of COVID-19. What issues need to be considered when putting these restrictions in place to ensure that they do not infringe upon individual rights?
Right. So I think these are all the elements and issues already mentioned by Ms. Park. It's ultimately, it comes down to a question of, is it really necessary to restrict that person's basic rights to that extent that you are trying to do? So just taking the recent gradual increase of the social distancing levels taken by our government, there has been some criticism from certain parts of the society saying that, well, the government should have really upped the level immediately, so to really prevent people from traveling unnecessarily, for them to just stay at home and limit their movement, so that we wouldn't have this kind of infection rate that we are experiencing right now. But that's all very well. But there are people whose livelihood actually depend on being able to move about and interact with other people, taking every precautionary measure that they can. And so we can't forget that. Just because you have a job possibly where you can work remotely, where you don't necessarily have to interact with anybody in person, where you're not having to worry about where your next meal is going to come from, it's easy to criticize, but we also have to think about the society's most vulnerable, which again, this pandemic has put a really strong highlight on. And with each measure that the government takes, it really has to consider very carefully and not make a populist knee-jerk kind of action implementing a measure just because they think, oh, this is going to be popular with people. And really consider very carefully what kind of impact it's going to have on ordinary citizens' lives and whether that is really necessary to protect us all in proportion to the impingement on their basic rights.
Right. The fear that you mentioned amid the pandemic is also triggering much hostility, discrimination against people from the Far East, as well as former patients of COVID-19. How severe is the situation?
Well, as you mentioned, the current COVID-19 outbreak has provoked quite a serious level of social stigma and discriminatory behavior against people of certain ethnic backgrounds, as the COVID-19 was, it was associated with certain city in the beginning, and as well as anyone perceived to have been in contact with the virus, and that includes people who's recovering from this virus as well. So one recent survey on the general public perception on COVID-19 really well illustrates the widespread fear of social stigma among us. And in this survey, conducted by Professor Myung-Sun Yu of Seoul National University Graduate School of Health, with 1,000 adult male and female nationwide, it says 7 out of 10 stated that they are more afraid of stigma they would get than the disease itself if they are confirmed of coronavirus infection. And what's really serious about this stigma, apart from this emotional trauma that these people would go through, the stigma can significantly undermine social cohesion and may also result in social isolation of the groups, which in turn might contribute to a situation where the virus is more, not less, likely to spread. And this can aggravate the pandemic situation and result in more severe health problems and difficulties in controlling a disease outbreak. It may also have a negative effect on quarantine and can hinder accurate epidemiological investigation because people suspected of infection may hesitate to report voluntarily or honestly, or may even try to avoid diagnostic testing at all because they are afraid of this condemnation if they are found to be infected with the virus.
It's a vicious cycle.
Yes.
Professor Cho, I understand that you believe the global spotlight on human rights in the face of the pandemic deserves some merit, though. Do you care to elaborate?
Sure. I just wanted to add to what Ms. Park just said with regard to the social stigma that people are afraid of, even more than the disease itself. There's not just the social stigma, but also economic and financial detriment that these people are likely to suffer as a result, because we actually know of cases where people have been fired because they've contracted COVID. And it's not their fault, right? You know, you don't sort of go out. I mean, you can take every care, but just because you happen to be unlucky, you could actually, you know, be infected with it. And so it's something that we really should desist from. But having said all of that, yes, I do think there are some positive aspects. And one thing is that it has made visible what has hitherto been invisible, in the sense that there were these problems lurking underneath that were simply not really very clear, that were really not part of the public discourse. But now we are talking about it because it has become such an urgent and pressing problem because of the pandemic. So for example, in India, 100 million people will be documented, i.e. they will get identification, which will actually entitle them to, you know, various social benefits that they may have been entitled in the past, but they had no way of proving who they were, so they couldn't actually get. And because of the pandemic, the Indian government has realized, and it's really sort of lit a fire, you know, under their backside, and they are really getting a move on. The second thing I would note is the development of vaccines. You know, we've never seen a vaccine for such a serious disease being developed so quickly. Now we know that it is possible, and as a result, I think we could possibly see even more brilliant development for hitherto intractable diseases, right? And domestic front, I think there are also blind spots in our own society, including migrant workers whose plights are highlighted as a result. And so those are the things where, going forward, we can really pay more attention.
Right. And hopefully the dialogue will continue. All right, as always, Professor, thank you very much for your thoughts, and thank you very much for being with us today.
All right, thank you.
Right, well, that is all the time we have for this edition of COVID-19. Tomorrow, we touch upon efforts to better support the medical supplies amid the surge in daily infections. In the meantime, do take care.